Good morning and good afternoon, everyone, and Happy New Year. I am Dr. Mariangela Palladino from the Scientific Department in High-Tech Industries. For many years, High-Tech Industries has been gathering experience in the use of the Roboderm technology in the different applications at an international level. We strongly believe in the power of sharing between experts and doctors, their experience, scientific researches, and scientific studies. Thanks to this in-depth work, we periodically provide our customers with the new and innovative protocols in order to reach the best icoone results. In today's talk, we have the great pleasure to have a speaker coming from Italy, Dr. Roberto Carnell. Good morning.
Good morning.
Good morning, Dr. Carnell. I would like to introduce to you to our attendees, and I would like to provide you with some information on the talk of today. Dr. Carnell is a sport doctor specialized in rehabilitation. He is head of the clinical department of Spondylos, that is a medical center in Conegliano Veneto, in Italy. Today, we will have a presentation with the title, The icoone Medikal as a valid support for the physiotherapist in the rehabilitation process. During the presentation, you will have the opportunity to write your questions in English in the Q&A session, and we will do our best in order to provide you with the answers. In any case, we will provide you with the answers by email. So thank you very much for attending to our talk and enjoy the presentation. And thank you very much, Dr. Carnell, to be here with us today.
Thank you. I worked in the past in the university for 20 years, and I work in the field of the research about the new technology applied at the therapy. And for me today is a good day because I can present my experience with a new kind of technology as icoone laser method. The myofascial system represents an extended network of connective tissue that envelops the muscle of the body, dividing them into the functional units, the fascia, and they connect all the various parts of our organism, upper fascia, and the various organs between them, visceral fascia. This is very important because we can work and we can treat between this fascia the visceral system, okay, for us is very important with all the modern problem. The myofascial system forms a ubiquitous network that envelops, supports, and connects all functional units of the body and plays an important role in metabolism and, in general, the well-being. The main principle we have is the contractures of the trauma, a marked fibrosis with poor elasticity and flexibility, and postural problems. In order to recover the myofascial system and to restore it, the main common treatment in the myofascial system, these functions are always being manual. Different techniques we have developed over the years, from very gentle treatments that use hands with help or oils or creams, or to more intensive treatment as the use of the copper rod. The choice of treatment had always been made according to the pathology to be treated, whether simple contractures of a trauma or with the implication of the tissue destruction, marked fibrosis, and loss of elasticity with over the leads to the well-known postural problems that characterize all dysfunction of athletes and modern men. In addition to this, in the recent era, a new trend was developed, inspired by the physical well-being with body care like never before, in order to obtain an optimal quality of the life, preventing pathologies such as osteomyofascial and all degeneration joint types. The old men in this age don't love more to remain or stay in stopped way, because they want to live his life until the end in their legs, we said in Italy. And they want to work, they want to run, to do what they do when they were young. And for this, they are in continually research of a new way to live, a new technology for obtain this result. This technology can be pharmacology, can be physiotherapy as our cases, and can be psychical. For this is very important our work in this period. In the concept of the anti-aging in a world that is progressively aging. This type of the treatment play a fundamental role in maintaining the physical quality, as I said before, and individually until the end of the life. Also, the muscle tissue or the fascia, what happened in this period? Progressive loss of elasticity of the muscle is involved by connective tissue pathologies. In fact, the muscle tissue progressively loses its elasticity characteristics because the protein that make it up progressively decrease, determining the characteristics hardness of the elderly. Then progressive loss of the proliferation of the growths, they disfigure the surface with spots, nervy and corpuscular peduncles. They need to interrupt the vicious circle had led us the study and methods to improve peripheral vascularization, so that the tissue remain nourished. As described above, hands for superficial and damage have been one of the main remedies over the centuries, but with the increasing demands for service, they become a source of wear and tear for the operations themselves, with the deficiency of the method itself. The use of irritative tools for the skin and the fascia with the aim of causing local inflammation, to dissolve the fibrosis, are not easily tolerated by patients who refuse to continue after the first session due to the pain they causes, especially in women where the amount of surface liquid is greater than the males. So we look for, and now we have found a technology to permit to obtain a good result without the pain, without the possibility that the patients have some problems about the treatment. When a patient has problems to meet the medical doctor or the physiotherapist, because he is hungry for the treatment, is not good. So for us, it's very important to create a good environment, and the treatment become very good for the satisfaction of the patients. With the connective tissue, then, with the fibrosis, with the dangerous of the problem of the age, need what the tissue need? A stimulation. Why? To increase the elasticity. We need to reduce the edema, especially on the legs, on the other on the hands, on the shoulder. Okay, reducing the fibrosis, and we need a stimulation to increase the vascularization. You know that when the blood don't arrive in the peripheral system, or on the foot, or on the hand, or in other part of our body, all the tissue became arid, and all the cells became very, very hard. And then what we do now? We have a new treatment. Roboderm is the unique technology in this moment on the board of the icoone device, and it is able to stimulate the connective tissue thanks to the multi-micro alveolar stimulation. This Roboderm starts from the study of Dr. Jean-Claude Guimberteau of Bordeaux University, and he described in a very, very fantastic way as is the connective and all the tissue superficial of the skin. The multi-alveolar stimulation is an effective stimulation for the reduction of fibrosis to support the physiotherapist in the rehabilitation process. Therefore, the continuous research has led us to study the paraphysiological mechanism that allowed us to achieve a good result without the patient suffering, obtaining indeed a gratification after the treatment done. This is very important because sometimes, especially in our country, sometimes the patient said, more the medical doctor is strong with my shoulder, my neck, is better is the result. In this period is not more so, because the fragility of the people and to bring all to not support a big treatment with the art of the physiotherapist. And then we researched this, a very good treatment for the pleasant of the patients. So the hands are not longer sufficient to maintain the elasticity of the tissue, and that is progressively degenerating, assuming those characteristics of tissue and hardened connective tissue, with a vascularization that progressively decreased and that created more fibrous tissue. Our ambulatory, our office, we have three office, and our medical center is specialized in rehabilitation, the sport rehabilitation, the treatment of the old people, and to the neurological people. And our rehabilitation concept is based on a global assessment of the individual's health with the aim of giving a complete recovery to the patients. We treat the person. We treat the person. We don't treat the pathology only, because every patient needs a particular treatment. Sometimes you can see in your office. Sometimes happen for the same pathology, a person or patients need 3 or 4 treatment, other 8. But which is the difference? Is the difference of the pathology? No, is how the patients live the pathology. For our is very important, this one, and our technology permit us to sustain the patient in the darkened moment of his life. When we use icoone laser method, we treat the chronic problems such as long-standing scars, treat acute pathologies such as a post-traumatic and post-surgical edema, in the fibrosis, okay, painful conditions, and the sportman recovery. This echo, you can see here, ultrasound, you can see a fibrosis in a sportman. We can see the impossibility of the ultrasound to pass under the fibrosis, and so you can see this all black. You can understand what happened when a patient have a particularly fibrosis. Our clinical experience. In the first time, I use this technology for my pleasure, because this technology gave me a very good result, because I use in my low back and my legs, because I was in the past a sportman, and then sometimes with the contracture I need often to have a relaxing of the muscle, and this relaxing of the low pain arrive between the possibility to stimulate my low back and all my visceral system, because when I use this kind of technology, for me I have a good result in my problem of colic system. But that is not demonstrated, because one case is not possible to write, because it is very simple, or is not statistic important. We have used this technology with our 8 professional football players. These football players, 8, they have a problem, or the muscle problem, with the first-degree lesions for 2 athletes with the first degree of the semitendinosus, 1 of the rectus femoris, 4 for the rectus femoris, 2 athletes for the semitendinosus, and 2 athletes for the problem of the hamstrings level. But with the problem of the second degree, so the hamstring level, the problem was the second degree of problem muscle. All the patients were treated traditionally. What we use normally, we use the bandage and the ice for the first time. Then we must use the MRI for the diagnosis. And the treatment is normally manual therapy. We do the radio frequency, and the laser, normally 8 power, is 1096 laser, and it is normally for 15 days normally. When the athlete return to running, okay, after the treatment, they all had an uncomfortable sensation in the area of the injury. They feel brushing on the area of the lesion, because it was impossible of the fascia near the muscle is impossible to very slow to move. It was the small fibrosis because it was attacked in this area, and ultrasound was performed which showed in all cases a scar that determined an important shadow cone, such as you show before. And then what I think to treat all the 8 professional football players with icoone laser med, 4 sessions every other day for 20 minutes each session. Which was the result? The sensation of retraction and joint freedom of the knee disappeared immediately. The result obtained, and more than good, using a tool that was accepted by the patients with a good level without having the effect of acute pain, as in other therapies or in the physiotherapist accompanied the athlete up to total recovery in a simple way. Okay, this is very important because you know that the professional athletes are very fragile in physiological way, because when they don't obtain immediately a result, became angry, have some problem, are nervous, and for us it's very important to put all day in a good way in the short time possible. The second treatment we use in my university, in my office, is the treatment after arthroplasty. This is an old man, 65 years old. He's a lawyer. He's a very important lawyer of our country. And he had left the hip prosthesis after necrosis of the femoral bone. After surgery, the patient complained about pain, heaviness in the left lower limb. The limb appeared visibly swollen and edematous. You can see the starting point in the first photo, and in the posterior part and the anterior part. The limb apparently visibly swollen and edematous, and the presence of the bruises observed. And this patient was nervous too, as the other. What we do for this one? We use the icoone medical laser medical protocol, 10 sessions every day. What are our results? You can see in the photo before starting point and after 10 sessions. The posterior part and anterior part. You can see a very good result in only 10 days. This is a very good result for us. The patient is very happy. And to send us other patients, all his friends came for our office for this one now. This is the second case. We did a rehabilitation knee in arthroplasty and corrective osteotomy. This is a man, always 65 years old. The patient's complaint of pain in the external compartment of the left knee and posterior twist of the gastrocnemius. The tissue edema was severe. There was present of fibrosis. The amplitude and mobility were really limited. You can see the starting point, and the protocol is the same of before. Number 10 session, frequency every day. The result, after the recovery, the patients reported that the pain had disappeared both when resting and during working and physical activity. Knee swelling also decrease, going from an initial circumference of 83 to 78 centimeters at the end of the session. And then you can see the difference of the score, the scale score for the pain and for the movement. Another case important for us, scarring tissue after cesarean session. And this is very important for us, and because one period of our life in our country, always our children born in the past with the cesarean session, for a very strange form of the gynecologist. And then in our country, we have some women who suffering the problem of the low back for this kind of scare, because all the muscle, abdominal muscle, become short, and then the multifidus muscle and all the muscle of the low back are longer, and then all the women go in flexion. And then we use normally the particular shoes with a very high tacket, and then this problem became more bigger. And then we have we had a very good result for the posterior system treating the cesarean section. Here you can see a very strong scare. The patients complained of tension abdominal region, especially during the physical activity. Okay, this woman is 51 years old. We treat always the same for a university protocol. We decide to use only 10 treatment. And what we have obtained. After the treatment with icoone laser method, the patients observed improved flexibility of her abdomen with a decreased abdominal tension, especially during the physical activity. You can see the difference. Here we have you can see the quality of the skin. This is what you must to see. The quality of the skin, because change the color. You can see here arrive more flow. Here the oxygen arrive to the tissue, superficial tissue, before the starting point. You can see the very white scare, and there became red. The scar is less adherent and softer. We observed an improvement in terms of functionality and the quality of the life. In conclusion, we can say that icoone laser method represents that extra something for the modern physiotherapist. And I want give you another important things. Because when the physiotherapist use this technology, is it possible his hand remain stopped, and then and he can work for a more long time, and then this is very helpful for the new work of the physiotherapist and the medical who work in this field. It allows the treatment of all patients quickly and significantly, reducing stiffness and improving the elasticity of the bands of the muscle treated, even in young people. A tool that improves blood supply and restore mobility to the connective tissue degenerate. Another thing I want to give to all is the use of the laser Why the laser is very important? The laser gives us another hand very important for the treatment of the skin, of the tissue, because the laser to bring the photon into the tissue, because the photon is very important for the energy. A German study demonstrated that the photon go to the mechanism of the energy of the tissue. And for this is important, the mechanics treatment, more the food, the photon is a very, very good combination. Thank you.
Thank you very much, Dr. Carnell, and I would like really to thank you, because I know you are very busy, because we need to say that you are a doctor, of course, and you are following your clinical cases in your center, but also you are following a sport team, and so you are very, very busy. So thank you for your sharing of your presentation, for the sharing of your clinical cases. I would like to say to our attendees that we created the book, the icoone best practices, with all your cases, with all the cases you are treating in your center with the icoone medical applications. Yeah. Now, I would like to read some questions for you, in order to give an answer to our attendees. One of that is about the fibromyalgia. And here there is Sandra, and she's asking if you have done treatments on patients with the fibromyalgia, and what's the feedback on that, if you have experience for the fibromyalgia.
Okay, the fibromyalgia is a particularly pathology, because comprehended three moments important of our patients. The first one is psychology, the second one is inflammatory, and the third one is the physiotherapy. And of these three moments, we treat the last one, and this is very important. Why? Because with the treatment of icoone laser med, I can give to the tissue the energy sufficient and the oxygen sufficient for the pain. So the patients have not more pain. And this is very important because the fibromyalgia, normally in France, is called in another way, because is called a contracture system. So when all the muscles are in contractures, no arrive energy, blood, and all the tissue became more hard. And in this case, you can use normally this instrument, because you have a very good result, because laser icoone mat can be to use very, very slow, so the patients can support in very good way the treatment. This is very, very important.
Yeah, for the microstimulations effect in terms to also to the relaxation of the skin tensions could be very, very useful. Thank you for that. And we have other two questions about the feeling. So what's the feeling and the feedback of your patients? Because you explained very well what is happening in a clinical point of view: reduction of edema, reduction of fibrosis, improvement of the vascularization, and our attendees are interested in the feeling.
But normally the feeling of the patient is good, because of the sensation of the patients when he or she do the therapy is very, very, very fantastic, because such as I said during the lesson, is very important to bring the patients in a good environment, a good room, a good physiotherapist, and a good technology. When you have these three moments, always the patients are happy.
So we can say you are creating a rehabilitation concept linked to the wellness concept. So you would like to give a relaxed wellness moment for your patient in order to rehabilitate, right?
Okay.
Good. And the other question, and the last one, I think, let me check. Yeah, it's about the feedback. We replied about that. And another one is about the benefits of the icoone. So which benefits the icoone has brought to the rehabilitation of your patients?
Normally, for me, it's very important for us when a patient asks again to do the treatment. Always, in this case, all the medical doctor and the physiotherapist are very happy, because they accepted in a good way the treatment, and they became with us participate at the treatment. When the big problem normally the medical doctors and the physiotherapists had, when the patient is not collaborate. If the patient not collaborate, we no obtain result. You can be the first medical doctor in the world, but you have no result. In this case, this instrument gives us the possibility to arrive near to the patient with a good treatment.
Thank you for this information and for this feedback, because I think it's an important point. Because normally, as you explained very well, we can see to the manual massage, manual therapies, and it's the main job of the physiotherapist, of course. But if we can offer an additional support, and if this additional support is well accepted by the patient, I think that we are going in the good way. So thank you for this feedback. There is the last question, I think, and this one is linked to the cerebral palsy, so paralysis, and after store, if you have experience about that, and after the stroke.
Okay, no, we have treated only two patients with a very important incident, straddle incident, or the road incident, who is broken the seventh vertebra of the neck, and the other the eighth vertebra of the dorsal vertebra, and we use principally for the edema, but sometimes the patients have a good result for the edema, but it's difficult to feel what happened in the periphery because they are not able to understand. And then two cases are not important for the statistics for me. This is a very small experience, but it's not important. So it is not, in this moment, is not
Yeah, it's not the focus of your work. Yes, clear.
Yes.
It's not the focus of your rehabilitation. It's really clear because you are making other things, other rehabilitations, and so maybe in the future you can think about that. But for now, you have a lot of cases to approach, and so it's really clear. Dr. Carnell, so we are concluding our talk. I would like really to thank you for the job you are conducting with icoone, and I would like also to thank your team, your Spondylos team, a great team with the physiotherapists. A lot of smart people are working with you in order to support your job, your clinical experience with the icoone medical device. And so thank you very much.
Thank you to Mariangela. But I want to salute a very important person for me, to Dico. I know in the past with a very good research man and an engineer, a very good person. Thank you. Yeah.
Thank you very much, really. I just would like to leave our attendees with the next appointment with the icoone talks on the 7th of February. So save the date and stay tuned. Thank you very much, Dr. Carnell.
Bye-bye.
Bye-bye.
Bye-bye.